Well, you can see it. So there's a question. Sir Jack is asking me, how do you know
reading the questions here,
if the vitamin C has fillers or what? So, okay. So if it tells you 500 milligrams, and the 500 milligrams, they're very tiny. Usually it's just a pinch, 500 milligrams. And they put it in a tablet. So most probably that has fillers on it. And that's why we were discussing about it yesterday with my good friend Mimi. And I was telling that Boston C actually has no filler. Not Boston C. Vitamin C.
all our products.
Also Boston C.
We have no fillers in anything.
Because we were talking about vitamin C. I'm so confused. Sorry about that. So, vitamin C, okay. So, the vitamin C that we have, it has no fillers on it. It's pure vitamin C. How ba ang maasim? Okay, they're asking if the sour is bad for people who have problems in the stomach. Okay, now not really. It depends on someone. Like vitamin C, diba? They kept asking, like, especially ascorbic acid is bad for people who have duodenal ulcer or gastric ulcer. Apparently,
that's not what the science says.
For...
That's not what the science says.
Yeah.
That's been studied scientifically, and the studies have shown and demonstrated that it's good for that.
It's good for you, okay? How many percent? If I'm not mistaken, 30%, okay, of people who are taking vitamin C is actually improved, okay, using your vitamin C. If you have problems with your ulcers, duodenal ulcer, yeah.
In fact, a quick question, Mom. When it comes to the body, if our body, we are missing the gene expression that allows us to produce vitamin C in the body. But if we were to produce vitamin C in our body like most every other animal on the planet does, what is the type of vitamin C that our body produces?
Ascorbic.
Ascorbic acid.
You know, we are the only, we are the few people
one of very few creatures on the planet that does not produce vitamin C internally. And the creatures that do produce it, they produce in their body ascorbic acid. So when folks
like
are trying to recommend, you know, sodium ascorbate or all these different types of vitamin C's, you have to understand that the one that is produced in nature is ascorbic acid.
Yeah. So again, tayo lang po, I mean us, fish,
a fruit bat, very few
people who have lost that capacity to make vitamin C.
For example, your dog makes vitamin C, your cat makes vitamin C, your goat makes their own vitamin C in their body, cattle make their own vitamin C in the body. Yeah. But we basically lost that gene that does that, which is why we have to intake it. You have to take it in.
That's very important, the vitamin C. If there's one thing that, you know, when we part ways today, if there's one thing that you have to look and you have to internalize, it's vitamin C. It's actually one of the, diba, there's even one, if you're in the group, the cancer patient support group, he was just taking vitamin C. It's Shanda Gohoy, right? Hello, Shanda Gohoy. Like, he took a screenshot of his nephew who was taking the vitamin C. Diba nakita nyo, ang laki-laki? Yeah, no, it was a mass on the underneath the on the neck. And then he's just taking vitamin C, diba? Hi, Sir Rick Cantrell. Yeah, he's just taking vitamin C, and the lymphadenopathy is shrunk. So that's how important vitamin C is. So again, if we're gonna separate today, if there's one thing that you have to take in, it's vitamin C. It's very important for all of us. Actually, when we are stressed, our vitamin C we have to take in a lot of vitamin C. Like, if we are stressed.
I'll explain that. Like, for example, a 70-kilogram adult goat, they'll produce about 3.5 grams of vitamin C internally every day. If they are stressed out, and again, this is all in scientific studies, which we'll be putting on drfarrah.com, I believe, this next week. So when that adult goat is stressed out, it'll produce up to about 13 grams of vitamin C per day. So if it will normally produce 3.5 grams, it makes one wonder, why is our recommended daily allowance in the milligrams. If a goat will produce 3.5 grams per day, why, as humans, is our recommended allowance in milligrams?
Yes.
Food for thought.
And our vitamin C, the Dr. Farrah Vitamin C, has no fillers.
No
Okay?
fillers.
Walang filler yan. So I think the best thing for everyone else is to take a pure dose of vitamin C. Yeah. Rick Cantrell said Dr. Pauling got the Nobel Prize for proving megadoses of vitamin C cures cancer. Yan sabi ni Sir Rick Cantrell. Dr. Rick Cantrell. Hello, Dr. Rick. I missed you already. Yan.
Is it safe for them to take vitamin C?
It is. It's safe for you to take vitamin C.
Because does vitamin C cause kidney stones?
No, it's not.
Is there any study that definitively shows that in the some history of medical literature in history that shows that elevated levels of vitamin C cause kidney stones?
No, nah.
It's anecdotal old wives' tale. You were taught that in medical school, weren't you?
I was taught, yes.
Without evidence.
But then I started giving it also to my patient. And I'm giving it mega doses pa nga, diba? 20 grams. And in some cases, they would, if the effect is not evident, they would take around 40 grams pa nga. So, and they would take it for a couple of months. Wala naman silang, wala naman nag-develop ng stones. As far as I know, that's it. I'm just talking about myself, my experience, because I don't want to influence other people as well.
Well, I can tell you there is no definitive study showing a causal link in the history of medical literature.
So this,
and it's a required nutrient.
Yeah, vitamin C is a required nutrient.
So how can it be good and bad?
Or vitamin C, okay? Again, if you look at the label, you can see the recommended dose is only 1 grams per day. But I have always been an advocate of mega dosing of vitamin C. So this is a suggestion for all of you. So what is mega dosing vitamin C? It's around 5 grams up until 25 grams or 30 grams per day. Okay? So makikita nyo.
Paris, California.
Yeah. So makikita nyo, diba may mga teaspoon sila dyan. Makita nyo naman in the label, diba? So you see that one teaspoon of vitamin C, it's equivalent to 5 grams. Okay? So if it's 20 grams of vitamin C,
it would be about 4 teaspoons.
Okay. Again, ulit-ulitin nyo na lang. Just review this. Just do the replay of this video. Okay?
Which basically, since we had to start a new video, the watching and interacting with this video does not constitute or initiate a doctor-patient relationship with Dr. Farrah. The information being provided by Dr. Farrah should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this broadcast or on any website or other medium of any kind associated with Dr. Farrah, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it.
Okay, so that's it. Again, what will you feel if you have been taking mega dosing of vitamin C?
Loose bowels.
So you will have loose bowel movement. Okay, so magtatai po kayo. So when you come and then maybe you will be saying like, Doctor, bakit ako nagtatai? It's normal for people to have diarrhea, especially if you are on mega dosing of vitamin C. But if you ask me if vitamin C can cause any adverse reaction or any formation of stones, no, it doesn't. I have never demonstrated that in the 16 years ko. Huwag ko kayong magagalit sa akin. Kasi mamaya, most of you, they will be upset with me like, Doctora, why are you advocating vitamin C when you know it's bad for the kidneys? No, it's not bad for the kidneys.
I will say this right now. There is no single study in the history of medical literature that shows a causative effect of vitamin C in excessive dosage causing kidney stones. There's just not. A lot of people think there is, but there's not.
Okay, so next is your Megadose Vitamin C. Okay, so the Megadose Vitamin C here. Yeah. Megadose Vitamin C is a better vitamin C. Why? So again, the packaging is a lot better. Okay. And it's a more concentrated and more potent vitamin C. Okay? So, nandiyan din po yung serving nila. Serving. So, yung nakalagay po sa mga serving, these are just recommended or suggested use. Okay? Especially to some of my clients, back then, some of my patients, when I left the country, some of them, I would give them high doses of vitamin C. So you can always, you can always ask me.
So if you have, if you're very interested with it, just go to drfarrah.com. Go there, so you can order, or also you can also order in.
They're any of our distributors.
Yeah, with our distributors.